الحمد لله رب العالمين والصلاة والسلام على أشرف المرسلين وعلى آله وصحبه أجمعين. Will Baby Clinic by Professor Mahmoud Hani Sulaiman. This type of clinics is some form to deliver health services for infants and children in many communities. Important points about Will Baby Clinic. This clinic assists development, weight, height, and head circumference. This is done at every visit and chart on growth scale. You put a point on growth scale every visit. Provide anticipatory information for developmental and milestones for the parents. Always ask about family adjustment, include mood disorders. Always have child abuse as a differential diagnosis, especially for unusual symptoms or injuries. Discuss vaccination and address parental question or hesitancy toward vaccination. Continued important points about Well Baby Clinic. Be aware of cultural factors and resources available, e.g. circumcision. Screen for anemia at 6 to 12 months in risk population. Example for risk population: lower socioeconomic status, low birth weight babies, infants fed with whole cow's milk in first year of life. Acetaminophen can be used as antipyretic in a dose of 10 to 15 mg per kilogram per dose every 4 to 6 hours. Ibuprofen can also be used in babies more than 6 months to 4 to 10 mg per kilogram for every 6 hours or 8 hours. So ibuprofen can be used if the baby is more than 6 months, 4 to 10 mg per kilogram per dose every 6 to 8 hours. Routine visits. Address all of the following at each visit. A. General questions. Note risk factors: family history, pregnancy history, delivery history, including resuscitation. Address parental concerns at every visit. Continued routine visit. B. Feeding. Exclusive breastfeeding recommended in first 6 months and encourage mothers who choose to do so. Breastfed babies should also receive 400 international unit daily vitamin D supplementation. Of note, 800 international unit daily for those in decreased sun exposure, like those living in cloudy atmosphere. No honey in first year is given. No beets, no carrots, no spinach or turnips before 6 months. No beets, no carrots, no spinach, or turnips before 6 months because they contain nitrates. Encourage parents to start with iron-containing foods when introducing first solids. Avoid dry, solid, round, smooth, or sticky foods that may lead to shocking, and sugary foods and drinks. Introduce new foods one at a time. Introduce new foods one at a time, with at least 3 days in between every 2 foods to monitor for reactions, to find reactions. No evidence that delaying any food beyond 6 to 12 months decrease risk of forming allergies. No evidence that delaying any foods beyond 6 to 12 months decrease risk of forming allergies. This is also true for children at high risk, those high risk for allergy, like those with siblings or parents with allergy, asthma, atopic dermatitis, allergic rhinitis. Continued routine visits. See developmental milestones. Should be monitored closely. We will describe it in details. Delay in achieving age-appropriate milestones may unmask an underlying developmental or learning disorder. This is about foods for babies from 0 to 6 months, from 6 to 9 months, and from 9 to 12 months. From 0 to 6 months, recommend exclusive breastfeeding for the first 6 months of life with 400 international units of vitamin D supplementation. Can express bleached milk, can freeze for up to 6 months and refrigerate for up to 3 days. Warm milk by placing in warm water. Microwaving can destroy vitamins. If feeding with formula, use iron fortified formula 5 ounces per kilogram per day for first 2 weeks, then increased. 6 to 9 months, start with iron fortified infant cereals, grain products such as dry toast or crackers, pured cooked yellow, green, orange vegetables, pured cooked fruits, ripe mashed fruits, pured cooked meat, fish, chicken, mashed beans, egg yolk. 9 to 12 months, plain cereals, whole grain bread, rice, pasta, soft mashed cooked vegetables, soft fresh fruits, peeled, seeded, diced, canned fruits in water or juice, miced, diced meat, fish, and chicken. At 9 months, offer high-fat yogurt, cottage cheese, grated hard cheese. Introduce whole milk from 9 to 12 months. Limit milk products to 720 ml per day because of risk of iron deficiency anemia. What are the developmental milestones? Developmental milestones. Age. This is differs according to age, and they are constituted of gross motor, fine motor, language, social cognition. At first month, gross motor, focus, gaze, startles with loud noises. Fine motor, sucks well on nipple. Social, calms when comforted. 2 months. He can lift head, chest when lying on stomach. Can lift head or chest when lying on stomach. Vision tracks past midline. Language reacts to sounds and cues. Social, recognize parent, smiles socially, comforted by touching and rocking. 4 to 5 months, rolls from front to back and vice versa. Can hold head steady when chest supported while sitting. Fine motor, can grip toys such as rattles, can follow movements with their eyes. Language at 4 to 5 months, laughs, squeals, starts to make sounds of consonants, can orient to voices. Social, likes to look around, laughs. At 6 months, sits with support, rolls from back to side. 6 months also transfers between hands, racking grasp. Language, babbles. 6 months, stranger, anxiety, turns head toward sounds, voices, pleasure, displeasure. 9 to 10 months, sits without support, stands with support. 5 motor, 3 finger, pincer, grasp. Language at 9 months, mama, dada, non-specific. First word at about 11 months. Social, can wave bye-bye, can play pat a cake, looks for an object that is seen hidden, responds differently with different people. At 12 months, can throw things, crawls, bump, shuffle, pulls to stand or walks. 5 motor at 12 months, 2 finger pincer grasp. Language at 12 months, more than 3 words, do not have to be clear, can follow one-step commands. Social at 12 months, imitates, has separation anxiety, responds to own name. Continued developmental milestones. At 18 months, walks alone, also feeds self with spoon with little spilling, learning body parts, responds when name is called, points to what is wanted, more than 20 words, imitate sounds and speech. Also, at 18 months, behavior is usually manageable, interested in other kids, through this easily, seeks out comfort when distressed. At 2 years, jumps, walks up down stairs with help, walk backward 2 steps without help, tries to run. At 2 years, can build tower of 6 cubes, puts objects into small container. At 2 years also, 2-word phrases. At 2 years, obeys 2-step commands, removes clothes alone. At 3 years, can ride tricycle, climb stairs with support of railing. At 3 years, uses cutlery and utensils, can copy a circle, can twist a lid of a jar, and he turns pages on one at a time. Also at 3 years, 5-word sentences. At 3 years, can brush teeth assisted, can wash and dry hands, understands 2 plus 3-step commands, shares some of the time. 4 years, can hop on 2 feet, can climb stairs with alternating feet, can copy across and square, undoes buttons and zippers, recognizes colors and some numbers, can play cooperatively and play board games, asks a lot of questions, tries to comfort someone that is upset. At 5 years, can skip and walk backward, can hop on one foot, can copy a triangle, can tie shoelaces, can recognize right versus left, can print letters, can throw or catch a ball. He speaks clearly most of the time in adult-like sentences. He can play dress up and domestic role playing. The education. These are things you have as a physician to talk about and educate in well-baby clinic. Car seat, helmets, bath safety, second hand smoke, sleeping position, crib safety, safe toys, fever advice, of course this with parents, child proofing, keep over the counter medicals and poisons out of reach, physical examination. Measure height, weight, and head circumference at every visit. Correct percentiles if born at less than 37 weeks until 24 to 36 months. Check skin, fontanelle, red reflex, heart, lungs, abdomen, umbilicus, hips, tone, muscle tone, testicles, and foreskin. Well baby clinic for children. General remarks. Always keep your differential diagnosis broad to include common medical problems as upper respiratory tract infections, pneumonia, depression, appendicitis, as they may present differently in children. For example, depression can present with increased aggression and anger in children and adolescents. At every visit of Well Baby Clinic, the physician asks about other aspects of their lives: school performance, friends, relationships, home life, bullying, modifiable risk factors as exercise or diet, and practicing preventive measures as wearing helmets and seat belts. Ask directly about risky behaviors as drug use, smoking, driving, and sex. General remarks continued about Well Baby Clinic for children. Advise adolescents that their visits are confidential, but try to encourage them to openly discuss these issues with their parents or guardians. These issues are sex, birth control, bullying, drugs, pregnancy, suicide, and depression. Always have child abuse as a differential diagnosis, especially for unusual symptoms or injuries. Always use age-appropriate language and try to talk to children and adolescents directly rather than just to their parents. When communicating with children, come to their eye level. Do not limit investigation if they are needed just because they may lead to distress for patient or parents. وفي النهاية أقول الحمد لله رب العالمين و thank you for your good listening.